life is complex.
So is our mental health. It cannot be understood by diagnosis alone.
Our philosophy is treat the person, not the mental illness.
Hello, everyone, and welcome to another episode of Humanizing Mental Health. I'm Trent Akers.
I'm Jeremy Alcorn.
And I'm Amy Alcorn.
Yeah. So, Jeremy, I heard that you had a very interesting conversation about cows the other day.
Yeah. It's a very curious way of being able to start this episode for sure.
Yeah, well, without spoiling it, I know the story, but I was just trying to think about it. But, I guess the old saying of, for those of you that are maybe not aware, but Jeremy and I and Amy were all based in Alberta, and one thing that is in Alberta a lot, along with oil, is actually cows.
Okay.
And one thing that cows do, besides going moo and giving us milk, is chewing their cud. Is that not correct, Jer?
Mm-hmm. Yeah. So I had this conversation with the doctor on base, and it really kind of sparked an idea inside me, something that I didn't know before. So we were talking about this concept of rumination, and ruminant is actually cud.
Yeah.
I didn't know this. I like the origins of things because it maybe helps us to better understand our world, better understand ourselves. So when a cow eats grass, that grass or other vegetation is actually very hard to break down and to digest. So it has 4 stomachs. Now, a lot of people know that. Maybe people that are not so much in a rural environment don't know that. So a cow actually brings... it works on that food in its mouth, brings it down to its stomach, and then later brings it back up and actually chews on that again. And it's actually called ruminant. So the idea of rumination, of us sitting and thinking about the same thing over and over again, is a metaphor. It's a metaphor for a cow that continues to chew its cud. Now, interestingly enough, that got me thinking about rumination in a different way. Most of the time we see it as a problem. And I'm curious, as I kind of poke at this idea, what your thoughts are.
For me, right off the bat, when I think about that, I think about when I talk to my clients about the difference between mind wandering and rumination. Now, particularly when I describe rumination to clients, I look at it in the sense of where you're going over an idea again and again. And you can even do this with other people, and where you're just scratching at the wound or just revisiting and not really re-examining it at different angles. Whereas mind wandering is sort of the stuff that we can kind of do in the shower, where, maybe those shower thoughts will come to us and we'll be able to connect ideas. And when I talk to them about rumination, it's about allowing our mind to wander and look at things from a different direction, but not always looking at rumination in terms of going over things again and again, because that can actually be, from my perspective and what I've known, and maybe I'll learn something different today, where that can actually just be very negative for people. Yeah. What about yourself, Amy?
Rumination is something that I just barely read an article about in class. Something interesting about it was they did an experiment with people who were chronic ruminators, and they had them do 2 different types of tests. So with one of them, these participants had to move their attention back and forth and multitask a lot. And in another one, they just focused on one thing the whole time. And they found that people who ruminate have a very difficult time going between tasks. So it made their ability to complete the tasks accurately and efficiently, their ability diminished because of the rumination. But when they did the task in which they just focused on the same thing the whole time, it actually improved their ability to be able to do this task. So the findings from this study show that people who ruminate a lot I would say it's almost like tunnel vision. Like they become very good at doing one thing, but once you need to direct your attention to something else, it becomes very difficult.
Yeah, and
Interesting.
it kind of fits with that bigger picture of, what is the function in the dysfunction? Like especially when you realize where the word comes from, that it comes from this concept of digestion in cattle. Cow cannot take something and on its first go finish it. It's impossible. It may be reasonable for us to say there's things in our life that we cannot just get past, that actually we need to be able to bring it back out, and we need to piece it and piece it and piece it until we've come to a place in which we can let go. Often, of course, within mental health, we're talking about people that are fundamentally getting so stuck, and we're seeing this rumination as a problem. And sometimes I think maybe we need to look at the function in it. What is this doing? What is it that you're stuck with, that you're trying to digest?
Yeah, like as soon as you bring that up, it makes me think of two specific mental health conditions, one of which that we've talked quite a bit about on the podcast, which of course is trauma and traumatic memory, and the idea that that memory gets stuck. And another thing too that I was just doing some more reading about the other day is OCD, and the fact that people are kind of stuck in those cycles. And it's about how do we help the cycle complete with trauma and get that memory passed through, or in the case of OCD, where it's almost like the part of the brain that helps us to recognize that a task is complete is kind of stuck. And in the book that I read called Brain Lock, it talks about the fact that your gear shift is basically stuck. So it's about, like, can we help that rumination go through so that it can process and then move on? Is that about hitting the area?
Totally. That totally makes sense to me.
Yeah. Thoughts, Amy?
Not with this one, just enjoying the content. It's
Yeah.
very interesting.
So, I would almost wonder, Jeremy, do you remember Peter Levine? Like, have you ever watched any of his videos?
Yeah. Like making sure that I've got the reference point right. So this is an individual that is body focused, that is somatically focused. What others might call the unconscious part of the mind, but he would really indicate this is a body process.
Yeah, like, did you ever watch that one? And for those of you, if you ever get a chance, watching Peter Levine work somatically is just amazing. And where, if we can think of like a physical version of this rumination, is I watched a video specifically with him working with a United States soldier that had been in a bomb blast, I believe, and was actually a bomb technician or near, and his body was actually going through something that was initially characterized as Tourette's, but where Dr. Levine actually noticed what the body was actually doing was actually trying to complete the cycle of protecting itself, and was actually going through and reacting to different environmental stimuli. And what, without spoiling things, is helped the soldier actually go through and complete the cycle. And of course, first found safety, but then actually went through like the moving of the arms, the moving of the neck, so that they could actually go through, bring up this powerful somatic memory, have it go through, and then process it properly, which of course really links into that idea of rumination, as it were.
What that makes me think about is when you bring it back to the cognitive realm, and the individual finds themselves in a pattern. For a lot of people, it is at night because there's no other stimulation, and it gets into a pattern. And I think that one of the things that would really jump out to me in using this metaphor, since rumination fundamentally is a metaphor, is to say, what have I not digested Like, am I still sitting on stuff that I've just chewed to death? There's nothing left to get out of this?
Yeah.
Or like, what part of this maybe have I not come to be able to either accept or problem solve?
Yeah, it makes me think of that small video that I sent you the other day, literally yesterday, where it was like where people are going over why. Like, why have they left me? Why don't, why, like, why don't they love me? And the thing is that in that moment, because a lot of us are looking for those external factors and it's about asking yourself, going a little bit deeper, and maybe doing that bit of a U-turn. And it's about, what about this don't I like?
Yeah.
What about this, speaks to maybe my attachment issue? What about this maybe brings up things in my past? Because I think, in some ways we're trained to chew on the environmental factors, things outside of ourselves, but it's about like, what's going on inside of me, and maybe can I chew on that and maybe find the nutrients that I'm looking for.
Yeah. Like I would say, as I think about my own process, times in which I ruminate, that it is about things I don't like and I can't change. In particular, for me, it's about things that I messed up, things that I did wrong, patterns that I held on to, and points of who I was that I was hiding. And being able to try to accept that is really hard. And so maybe some of what people say, you got to do the work. People keep saying, you got to do the work. Well, what are they really talking about? And I would say it's a lot of that work is emotional. It's sitting with things you don't like, things you can't change, things that you've done that there's no way you can fix. And sometimes that means that you got to chew on it for a while before you can accept it.
Absolutely. And when you bring that up, the words that are just screaming in my head right now, and it's sometimes the hardest thing in the world, is self-compassion.
Yeah.
Yeah. Like, and like where, for a lot of us, like when you think of self-compassion, because a lot of us have that inner critic, and, sort of that person that maybe is part of that rumination that will point out those things. And I'm not trying to say that the inner critic is wrong or that the inner critic is bad and that we need to push it away. Rather, in those moments, can we take what the inner critic says? Can we go from like a CBT perspective and kind of go down to the core of that message? But can we take that kernel and can we put it in a way of making it more compassionate, making it like, for example, right? Like if I'm on a diet and I eat a whole bag of Oreos, which I am prone to do, I do like my Oreos. And if I eat more than I want to, or more that are best for me, rather than sitting there and ruminating and saying, I'm so fat. Oh, I'm not going to be able to do this. Can we just change our language a little bit and kind of say, right now, maybe I ate too many Oreos, but could this be an opportunity to change again and to maybe do better next time? Or could you think about, like, when I'm eating those, what's going on inside of me? What am I trying to fill up or satiate with those Oreos that maybe I could get somewhere else?
Mm-hmm. Yeah, see some big nods from you, Amy.
Yeah, well, every day is a new start. If you think you have to wait until New Year's to start new resolutions, then you're not going to get anywhere. Every day is a new resolution.
Absolutely. And like when we think about that rumination, going into those old patterns, you're not just going to wake up one day, look at that inner critic and go, be nice to me. And it's going to be like, okay, sure. What the heck? Let's go. I'm your best buddy now. I'm your cheerleader. I'm going to be there to give you constructive feedback. No. Like that, this is a learned behavior. This is something that is, like Jeremy has said, is good for us, but it's how, well, like, we've learned to take that feedback. So can you notice that? And when it is not being the most compassionate or the most helpful, can you redirect and maybe just try and say, hey, how would I say that to my best friend? Or better yet, if I were talking to a small child, how would I say that to a small child?
For sure. Yeah. And when something comes back, when it shows up again, and being curious, being like, is there a part of this I haven't digested?
Yeah. And you know, I like that, like reading it with curiosity and almost welcoming. It's saying, hey, thanks for coming back. What do you have to share with me today?
Because lots of times those feelings become so big, so powerful, and doing the work is realizing that you can't just somehow turn them off.
Yeah. And you know, I like the fact that maybe this issue is not something you're going to solve today. You know, and if it does come up at night, could that be an opportunity for just some quick journaling? Like, you know, like even, you know, like if your mental stomach brings it up, does that mean you have to chew on it right now? Or could you put it on a piece of paper and chew on it in the morning?
Yeah.
Maybe put it on a piece of paper and chew that paper.
Maybe, you know, good fiber.
Yeah.
Yeah.
I was going to say, when I have issues with ruminating on something, sometimes I'll stand up and literally shake my whole body to try to shake it out. Because when it's stuck in here, it's not just stuck in your brain, it's stuck in your entire body. Because our muscles hold tension, they hold stress, they hold memories. And when you move your muscles and you shake yourself, just like how a dog shakes themselves after they've had an encounter, then you can help move that feeling through your body. Because emotions aren't just in our heads, they're in the entirety of us.
They call them feelings for a reason.
Yeah.
Yeah.
That makes me think of a really cool exercise that was taught to me by our resident vagal toner here at the office, Jamie Adams. Amy, have you and Jeremy ever heard of? Sorry, I should have addressed you both individually about a vagal massage.
Yeah.
Yes. Do you know the ones that I'm talking about, where you shake out your hands and all that jazz, Amy?
I don't think I've done the hand one. I haven't heard of that one.
Okay. So for our listeners that are listening to us, this is actually something you can find a really good YouTube video on. And these are actually things that you can actually do different exercises to make it so that when our vagus nerve is actually overstimulated, that we are seeing things or hearing things maybe differently, because we have such high vagal tone that we can do things to help calm us down and to open up our nervous system. And maybe if you find yourself ruminating and you're really anxious and you're wanting to chew on this, try doing one of these exercises to see if, when you're ruminating, if this will give you a little bit more room to see more angles. What I'll probably do, because I don't really have the room to demonstrate it here on camera, just because I have the mic in front of me and I don't want to hit poor Jeremy with my hand. What I'll do is I'll set a link to a really good video that I use with a lot of people in the show notes. And what I recommend to people is that this is not only good for when you're ruminating, but also if you're in a couple, to do this either before, during, or after a really difficult conversation, to see, so that you're setting your nervous system up for success. Does that make sense, Jeremy?
Yeah, totally.
Yeah.
I think, Amy, you experienced something recently with like a vagal toning in some way. Were you interested in sharing?
Sure. So I do see Jamie, which Trent mentioned. Um, and what we do is we talk about my feelings and what's going on. And she tries to bring up strength, which I really appreciate because I personally feel like when I'm in therapy with somebody that usually it's all these negative stuff that I bring up. With Jamie, she likes to bring up the strengths, the positives. For instance, like, so you're feeling anxious, what can you do when you're feeling anxious? You can focus on your breathing, you can focus on your feet, grounding yourself to the floor. So that those are some things that she would help me with. And after we're done talking, I lay down on this bed and get really comfortable and relaxed and zen. And she shakes me and does different types of massages on my back and my legs. And she'll integrate other senses. So she'll use like different sprays for smells, and she'll have like chimes that will sound different to different people. To me, they sound really relaxing. And she'll ask me about my experience. What did this mean to me? What did that mean to me? And it's this really like wholesome experience that connects both my mind and my body together, which is a little silly because the mind and the body are technically the same thing, but it connects my headspace to my physical space. And yeah, I would highly recommend, if people who are listening, if you have anybody who does what is called vagal toning or something of the like, somatic therapy, I would highly recommend. I know CBT is very effective for many people, but for some people, they need to work things out like physically as well. So
Yeah.
Mhm.
And what I'll say sometimes with Jamie, and I think that's an excellent explanation of what's going on with her. Like sometimes how actually Jamie and I will tend to work in concert together is that she may do vagal toning on people, like where they go through with what Amy talked about, and then they will actually come to me afterwards, and after they've kind of brought in all of that stuff up, maybe ruminated on it a little bit, then we'll go back through and we'll integrate those learnings and that knowledge. Because sometimes, like Amy has said, when you're just going at things from a cognitive level, it can be more difficult. But when you get that physical grounding, then maybe you can find those integrations or the more cognitive pieces with somebody that does more traditional talk therapy.
Mm-hmm. Yeah. And in the end, all of it is about, we need to digest our experience. The spots that get stuck, they need more process. This is the work we do, reconnecting to ourselves, finding a way for us to be able to eventually integrate what we've been ruminating on, so that we can let it go.
Absolutely. Yeah. Well, and like when you say let it go, like I think that when you say that also too, being okay if it comes back around again.
Yeah, for sure. Right. Then maybe that there's stages. Maybe at another point in my life that becomes very relevant again, and because of that, it becomes hooked back into a rumination. And we don't want to beat ourselves up or like get angry at ourselves for like being where we're ruminating again.
Yeah, because like I would almost wonder too, like, as an older person, if you ruminate on things when you had when you were younger, I can imagine that you'll be reflective with that, you potentially using different insights and perspectives.
Yeah, for sure.
Yeah.
In fact, if it's all right, I'm kind of thinking that I'd like to give a quote that'll kind of pull this together.
Sure, go for it.
And then maybe if we can give our own reflections on this episode before we wrap up.
Sure.
I do have a few things to say, by the way.
Oh, okay,
So,
perfect.
you go first.
No, this will pull things together. You go first.
Okay, so I have a couple things to say. Um, another method that I like to use to try to um create a better space for my mental health is earlier in the episode you guys mentioned that it can be difficult to go to bed for people who ruminate because their mind spins and they can't sleep. One thing that I like to do before I go to bed is to put on my headphones and listen to theta waves. Um, or there's different kinds of waves as well, like delta or alpha waves, whatever is the most comfortable with you. I had to do some experimenting and I like theta waves the best, but I'll just listen to it for like half an hour or a whole hour and not be on my phone because electronics are also not great for sleep. They can overexcite your brain. And yeah, that's what I do. And it'll just make me like very sleepy eventually, and I'll just go to sleep. What I don't do is try to force my thoughts to try to be quiet. I just listen to my thoughts and I accept them. And eventually, because these waves are made to help you relax, I do relax and I go to sleep. And when you create this habit that you do every single night, it kind of trains your body to get into this good cycle of knowing this is my time to wind down. This is my time to go to sleep. And so it does help over time for you to not ruminate as much and to get better sleep. Another thing I'd like to say is I think it's important to not only give you time to relax, but also give yourself time to experience your emotions and ruminate. There was this methodology that I learned in therapy called the container. And everybody's container can look different. You make it personal, you make it your own. It's something that is not a physical container, but it's in your mind. For me, it was a big bucket because I thought that was funny. And when you are feeling stressed and overwhelmed and you're like, I can't deal with this right now. I'm at work, I'm at school, I have to focus, or I'm in the middle of a task and I can't be dealing with this, you put it in your container. So you picture a container in your mind's eye and you picture whatever you're going through, whatever you're ruminating, and you put it in that container and you put it away and you tell yourself, I'm going to deal with this later. And what you do is you fulfill that promise to yourself. You do come back to it later when you have the time and energy to be able to, because if you don't, that container is going to explode. So those are a couple things that I would highly suggest for people who do ruminate, because I don't think it's the rumination that's the issue. I think people have an issue with the timing of the rumination, with being able to tune it off when they have to focus on other things.
Yeah, totally makes sense to me. Yeah, and I really appreciate giving some guidance really to help people know, how do I digest this?
Yeah.
The rumination isn't the problem. It's more a matter of, is it filling up so much of my life that I can't function? Is it getting in the way of me working? Is it getting in the way of me sleeping? Cows don't ruminate when they're asleep.
No.
Think about that for a second. That's where the metaphor comes from. It comes from cows. They don't chew their cud, they sleep.
Yeah.
And we need to be able to know, when is it that we really need to work on what we've got to digest, for sure. I really like that. Fits well with the metaphor. And then I think underneath this is also one of the reasons why we're ruminating is about acceptance. It's about finding our way through our feelings till we can create acceptance. And there's a quote from my favorite author. I may have shared this before, but I think it really fits with this topic, so I'd like to share it again. It's from the Stormlight Archives by Brandon Sanderson. And this particular character that's speaking is Dalinar Kholin. He says, the ancient code of the Knights Radiant says journey before destination. Some may call it a simple platitude, but it is far more. A journey will have pain and failure. It is not only the steps forward that we must accept, it is the stumbles, it is the trials, it is the knowledge that we will fail, that we will hurt those around us. But if we stop, if we accept the person that we are when we fall, then the journey ends. The failure becomes our destination. To love the journey is to accept no such end. I have found through painful experience that the most important step a person can take is always the next one.
Love that. Love that. And like as you were reading that, I couldn't help but think of that quote from Batman Begins. Why do we fall, Master Bruce? So that we can learn to pick ourselves.
Yes.
And that was, and I think as it said, the most important step is not that we fall, but it's about what are we going to choose to do after that.
And I think for myself, as I pull my kind of reflection together, I think that where rumination fits in my life is that I'm trying to find my way towards the next step.
Mm-hmm.
I'm trying to accept the stumbles, trying to accept the character weaknesses, the things that I've done wrong. And that isn't easy. And it's not something that you can just digest all at once.
No, absolutely. And it's so interesting. Just circling back to that, or leading off of that, if I may, we have so much compassion. We see so many strengths and abilities in others. It's so outwardly focused. And if we were just 10% more compassionate to ourselves, or just took 10% of the compassion that we would give to other people and gave just 10% more to ourselves, imagine what that would be like. Just 10%.
Yeah.
What about for yourself, Amy?
Yeah. I think rumination can serve an important purpose. Otherwise, we wouldn't do it. We've evolved to be the way that we are. Going back to what I said earlier, I think it's important to be able to direct when and where we use that energy. And it takes time, and it takes experience and failures and successes, being able to learn how to do that. And every environment's different. You might be able to figure out your rumination in one environment, then you move somewhere else and you're overwhelmed again, and that's okay. Giving ourselves compassion and patience is important.
Yeah. Awesome. And I love that. I think that's a great way to end off, if that's okay with you, Jer.
Mm-hmm.
On that note, I'm Trent Akers.
I'm Jeremy Alcorn.
I'm Amy Alcorn.
See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.